Welcome, everyone, and thank you for coming out on this cold day. Before I get started, I want to advertise my scarf. If you like these, my sister-in-law, who's a scleroderma patient, Nirja Bhagat, she actually made all these, and they're on sale in the back if you're interested. I'm going to save about 15 minutes at the end for any questions that anyone may have, but if you need clarification in between, then please feel free to go ahead and stop me, okay? I just want to make a disclaimer right from the get-go. There is no special diet that will cure scleroderma, okay? Good nutrition is part of the treatment plan that will help manage your condition and improve overall health, and it should be a part of your day-to-day care. The symptoms and severity of the disease vary greatly in each person. Even within this room, there are probably a whole range of different symptoms and manifestations of the disease process. And what I'm going to try and do is go over some of those and hopefully help give you some ideas to help manage some of those symptoms that you may have. All right. But what we want to do and what's important, our goal is to establish a balanced diet that emphasizes foods that fight inflammation and provide energy, protein, vitamins, and minerals. I'm sure most of you are well aware of this, but systemic sclerosis is a condition in which the immune system overstimulates the collagen-producing cells of the body, causing inflammation and an excess buildup of collagen. And so with our diet plan, what we want to do is provide anti-inflammatory properties and antioxidants that work against this inflammatory process. All right, so this leads to hardened skin and fibrosis of internal organs such as the lungs, digestive tract, and blood vessels. Patients who suffer from scleroderma are at an increased risk of malnutrition, and this is caused by two main reasons. The first being inadequate intake of nutrient-dense foods, and the second being poor absorption of nutrients from the GI tract. So individuals who don't take in enough because of issues chewing, swallowing, or other GI manifestations that may have, or difficulty preparing their own food, may suffer from inadequate nutrient intake, and this could cause excessive weight loss and malnutrition. If, on the other hand, someone has extensive GI involvement, even if they eat adequate amounts, they may not be absorbing all that they take in. And with this malabsorption, this may lead to vitamin and mineral deficiencies with or without obvious symptoms. So what we want to do is we want to choose antioxidant-rich and anti-inflammatory foods. And this is really good for everybody, whether they have scleroderma or not. This is a great diet to follow in general, okay? So lots of fresh fruits and vegetables. I always tell my kids, eat a rainbow, okay? So choose foods from all different categories, eat lots of, you can get purple and red and orange and yellow, so try and get a whole variety of colors in there, okay? These fruits and vegetables are high in vitamins and minerals and fiber, and this will help, especially if you have any GI issues, ranging from constipation or, the whole gamut of GI issues. Fiber helps with all those things. And the antioxidants in your fruits and vegetables act as free radical scavengers. So these things work against inflammation by scavenging all your free radicals that are in your body. Let's see. So you want to always eat 100% whole grains, okay? When you eat white products, the husk of the wheat has been removed. And with that, you're removing all the vitamins, minerals, and fiber out of the wheat. So you're really left with minimal nutrition in the white bread, white rice, white pasta. There's not much left there. except for some starch. A lot of these products are fortified with iron and vitamins B12, but it's nothing compared to what they're removing when they're polishing the wheat and making the wheat white. Okay? So how do you know that you're eating whole grains? You want to look on the nutrition facts label on the back of every food package and look at the ingredients. And the first ingredient should always be whole grain. So it should be 100%, like if you look at 100% whole wheat bread, which is the optimal kind of bread to eat. The first ingredient should be whole wheat flour, okay? Or if you're looking at like an oat product, it should be whole grain oats. So you want to look at the ingredients list and make sure that the first ingredient there is a whole grain product, okay? Refined grains, all your white products, require an increased secretion of insulin, all right, to digest these products. And this increased insulin that's circulating in your body is actually a pro-inflammatory substance. So it's really kind of working against our anti-inflammatory, antioxidant-rich diet that we would like for everybody to have. Herbs and spices. I've read a lot lately in magazines and heard a lot about turmeric. Turmeric is actually now known as the golden spice. Quite literally, it's a beautiful, bright yellow color. And a lot of research has been done, and it's actually been shown to decrease osteoarthritis pain, and in some studies worked as well as ibuprofen in decreasing this pain and inflammation. So definitely has antioxidant, anti-inflammatory, and anti-cancer properties. And we actually use it a lot in Indian cooking. We've been using it for thousands of years, I guess. But some other spices, the top 10 spices, when I looked this up, that contain antioxidant, anti-inflammatory properties are cloves, allspice, cinnamon, rosemary, thyme, marjoram, saffron, or oregano, tarragon, and basil. So whether it be in the dried form or the fresh form, these all have really great antioxidant properties. So use lots of these in your cooking. Moving on to the fats. I'm sure you've heard a lot about omega-6 fatty acids versus omega-3 fatty acids. The omega-6 fatty acids are actually pro-inflammatory. Okay, so they cause inflammation, versus omega-3 fatty acids are anti-inflammatory. So those are the ones we want to eat more of. We want to limit the omega-6 fatty acids. In the North American diet, the typical intake is 20 to 1. So we're eating 20 times more omega-6 fatty acids than the omega-3 fatty acids. So we really want to change that, okay? And the omega-6 fatty acids are mostly found in all your processed foods, okay? Your salad dressings, mayonnaise, those types of things. Anything that is found in a jar or a can or any kind of processed foods contain this omega-6 fatty acids. The omega-3 fatty acids, on the other hand, are found mostly in your cold water fish, okay? So your fatty fish, your salmon, mackerel, trout, fresh tuna, sardines, those types of things, okay? And other things include walnuts and flaxseed. So those are the other things that are high in omega-3 fatty acids. If you don't like fish, you can always ask your doctor about taking an omega-3 supplement, okay? The only thing to remember with that is that the omega-3 supplement also acts as a blood thinner, so you want to be careful with that, especially if you're already taking a blood thinner like Coumadin. So definitely talk to your doctor before starting to take something like that. And if you're going in for surgery or something, you may have to stop that a few days before surgery because it does act like a blood thinner. And the omega-3 fatty acids, the other benefit is that it improves blood flow and has also been shown to decrease symptoms of Raynaud's, okay, which I know is very common in your scleroderma patients. probiotics and prebiotics. So probiotics help decrease inflammation in scleroderma patients. So your probiotics are all your live and active cultures that are found in your yogurt, mainly, okay? And it's been shown that if you take 5 to 10 billion colony-forming units daily, which is found in about half a cup of yogurt a day, it will improve symptoms of gut motility and decrease bloating. Prebiotics are what the probiotics feed on, and this includes soluble fiber, okay? So all your fruits, legumes, and even some fiber supplements like Metamucil or Benefiber, those are considered prebiotics. So eating even like a half cup of yogurt a day has a lot of benefits for GI motility. And daily multivitamin, anyone who has a chronic disease really should be taking a daily multivitamin, because there are some days where you're just not eating, as much or as much of a variety of foods as you should, and are not getting the vitamins and minerals that you need on a daily basis. So a daily multivitamin is definitely a benefit. All right. So moving on, other nutrition recommendations. Limit highly processed pro-inflammatory foods, okay? So basically anything processed that comes in a box or a can, we should try and avoid, including added sugars, especially high fructose corn syrup, all right? High fructose corn syrup increases fat deposits in the liver and increases plaque buildup and narrows blood vessels. And this is found mostly in your baked goods, most processed foods, again, canned fruit even, especially the one packed in syrup. Go ahead.
So if you're going to be bad and have cake, seriously, I'm going to have cake.
Mm-hmm.
Is it better to make your own cake?
It's always better to make your own. Do you want to repeat? Did everyone hear the question? If everyone heard yeah.
So if you're going to be bad and have some cake, is it better to make your own cake rather than buy one at a bakery?
It's always better to make your own anything, okay? So because you know what you're adding to it. For example, if you're making your own cake, you could even use whole wheat flour. You know what I mean? Like I've made lots of cakes.
I have a problem with wheat.
Oh, you might have a problem. Okay. Well, what kind of cake would you eat then from a bakery?
Yeah, I know, that's right. I'm working on it. That bread is atrocious.
Yeah. Right. So, but in general, yes, it is better to make your own things. You can use even white whole grain. Has anyone seen this white whole grain flour that has all the nutrients of whole wheat flour in it? Okay, except it's white, and I make pancakes and everything out of it, and it tastes great. So my kids don't know the difference. You sure? Go ahead.
I just wanted to find out, is there a difference between Greek yogurt and regular yogurt in terms of those probiotics? Because
no.
Okay.
As long as it should say on the container, contains live and active cultures. And then it contains the lactobacillus that you want in the yogurt. Mm-hmm. Yep. Yep. How about eating out? Try and avoid eating out. Yeah. Because you don't know what they're adding to the food. They're always trying to cut corners and save money on everything. So if possible, try and avoid eating out. And that's not only for scleroderma, it's for anything. You have heart disease, diabetes, you just don't know what they're adding to the food. Occasionally, sure. Occasionally, absolutely, is fine.
But how about wine? Good wine.
How about wine?
Yeah.
We'll go over alcohol a little bit later. Okay? Okay. So anytime, again, if you look on the ingredients list on a food package and it says, if I pick it up and I see it says high fructose corn syrup on it, I'll put it back immediately. I won't buy it. So that's one of the things you should look for and try and avoid if at all possible. Okay, it's a cheap form of sugar. So the regular sugar is about 50% glucose and 50% fructose. This high fructose corn syrup is 80% fructose and 20% glucose. So it's been modified. It's not a natural sugar. The other thing you want to avoid on a food label is hydrogenated fats or partially hydrogenated oil. And what hydrogenating the fat does, they're basically bubbling hydrogen through the oil in order to make it a spreadable fat. So like margarine, for example. It turns vegetable oil into margarine. They bubble the hydrogen through it, and it stays in this nice, soft, spreadable state. And hydrogenated fats are cheaper and increase the shelf life of the product, which is why manufacturers are using it so much more in this day and age. All right. The other thing that you want to avoid is trans fats. And they've actually recently started putting the trans fats on the nutrition facts label. It wasn't there until recently. So you can look at the nutrition facts label itself, and under fat, it'll say cholesterol and it'll say trans fats. So another thing you want to avoid. Trans fats will increase LDL, which is your bad cholesterol, and it'll decrease HDL, which is your good cholesterol. So it's double trouble. Okay? And it basically decreases the body's ability to produce natural anti-inflammatory prostaglandins. So again, it's working against all the anti-inflammatory goodness that we want. And again, avoid refined white grains wherever possible. All right. So the ideal diet is the Mediterranean diet, and I'm sure you've all heard of this. This is rich in antioxidants, vitamins and minerals and fiber, and it decreases the risk of diabetes, coronary artery disease, cancer, Alzheimer's, and Parkinson's. So it's just a great all-around diet to follow. And it includes lots of fresh fruits and vegetables, whole grains, fish and seafood, legumes and beans, olives and olive oil, nuts, and herbs and spices. So this is definitely something that you want to keep in mind. Now I want to go over some of the potential symptoms that you guys may be having and give some maybe tips to manage these symptoms. All right. So if you're having problems chewing or swallowing, some of the things you can try are modifying the texture and the consistency of foods. So if raw fruits and vegetables are just too hard to chew and swallow, or if you have mouth pain or ulcers or anything like that, you can always blend them into juices or even make soups and blend the soups. All right. So different ways of including our fresh fruits and vegetables. Make homemade smoothies using fruit, yogurt, 2% milk, Carnation Instant Breakfast, or whey protein powder. Okay? Greek yogurt is really great to use in smoothies because it's nice and thick and gives it nice creamy consistency. And it also contains much more protein than regular yogurt because it's been strained. So all the water, they get rid of all the water. And that's why it's so thick and creamy. Okay? So it's a concentrated form of calories and protein. There's also a place for nutrition supplements. I don't know if any of you have ever used Carnation Instant Breakfast. You get it in a grocery store, powder, you mix it into milk. Or even things like Ensure or Boost you may have heard of. You know, it's something quick and easy that you can grab if you just don't feel like getting up or making a meal. Or, you know, if you're fatigued, something easy to keep around that you can sip on throughout the day and increase your intake of calories and protein. You can even use that as a base for making a shake. You can add additional milk powder to it to increase the protein. You can really flavor it any way you like. I have patients who will add peanut butter or add fruit, just to add more protein and calories and flavor it however you like. Include soft, moist protein sources during meals and snacks. And I have some suggestions for those here. So things like cottage cheese and even canned fruit, scrambled eggs, yogurts, puddings, fish or chicken with gravy, ground meats, macaroni and cheese, lasagna, mashed potatoes. Some of the things that you can try that are softer, easier to chew and swallow. And really, you can modify the consistency of any food. So you can put anything into a blender, and modify the texture or the consistency to make it easier to chew or swallow. Things like meatloaf can be put in a blender and pureed. It'll still taste the same. It won't be the same consistency. It'll be easier to chew, easier to swallow. Or even tuna noodle casserole. That's something that patients have said that comes out decent, even though it's been through a blender. If you suffer from reflux or heartburn, you want to eat small, frequent meals to avoid overfilling your stomach. Okay? If you overfill your stomach, basically what happens with reflux or heartburn, that sphincter muscle, the pyloric sphincter muscle, which joins your esophagus to your stomach, it gets stretched, and then you have like a regurgitation of food into the esophagus, which is what causes the heartburn. All right, so eat small, frequent meals to avoid overfilling your stomach. Eat slowly. Avoid eating 2 to 3 hours before bedtime. So don't lay down immediately after you eat. Okay, so sit up and let gravity work. If possible, elevate the head of your bed to prevent regurgitation of stomach acid. And antacids such as Tums are a good source of calcium, in addition to being helpful with reflux. Some of the foods that may aggravate your symptoms of reflux are your citrus foods, like oranges or orange juice, tomato products, tomato sauce, greasy fried foods, garlic and onions, alcohol. You were mentioning alcohol, so alcohol could possibly cause reflux or heartburn. Peppermint and chocolate. Peppermint and chocolate, what they do is they cause relaxation of that sphincter muscle, the pyloric sphincter. So they cause relaxation of that, which aggravates heartburn and reflux.
Alcohol is like one shot a day.
Yeah, and you know what? It totally depends on the patient. You know what I mean? Like some patients can take 4 ounces or so of alcohol a day, and it won't bother them. But for other patients, it may aggravate their symptoms of reflux.
But this is red wine is very good.
Yeah, sure. Red wine is an antioxidant.
One shot a day.
Yeah, sure.
I think he's going to get his way no matter what.
And again, this is totally individual. So some people, this may not bother them at all, or you might not be able to take more than a little bit of something. Like you may not be able to have a huge bowl of pasta with tomato sauce and a glass of wine. So kind of go by trial and error. And then the other things are caffeine and carbonated beverages. If you are chronically fatigued, again, eat small, frequent meals throughout the day. Every couple hours, try and keep, something little, like a yogurt or a pudding. Every couple hours, try and get something in, okay? Eat when you're at your least fatigued time of the day. Eat when you have the most energy. Eat the biggest meal then. It may be in the morning, it may be later in the afternoon, but when you feel at your best, you should try and sit down and, eat a good, healthy meal at that time. And if you are fatigued, again, keep things around like the Ensure supplements or Boost supplements. Keep things handy and available that you can just pull out of the fridge and eat without much effort. Drink plenty of fresh, filtered water, okay? Dehydration causes fatigue, so you definitely want to keep your body hydrated at all times. Attempt 30 to 60 minutes of exercise daily, okay? And this doesn't have to be, running or anything very strenuous like that. Any kind of movement will increase circulation and even help with symptoms of Raynaud's. So something, even just walking, get out there and do something. Movement for 30 to 60 minutes a day helps tremendously.
Does exercise cause inflammation?
No. Why would you? Why would? Not that I have heard or.
The need for antioxidants, does that increase when you exercise?
I don't believe so, no.
You don't think so?
No. I mean, how much are you exercising? You're not running, maybe if you're running a marathon or something like that, but I don't think
I
like.
walk and I run.
Okay.
I jog.
Yeah.
And I just wondered if that should be eliminated because of the inflammation. I thought it caused inflammation.
Muscle inflammation, maybe?
In your body.
No, I don't think it causes bad inflammation at all. I mean, if anything, exercise is great. It increases the circulation, increases muscle strength, and.
I was told that it increases inflammation.
Not that I've ever heard.
Okay.
So, no.
I don't want to stop that. That's
No, I wouldn't stop that at all. Go ahead.
Just in response to that, what my doctor told me is if you have inflammation, like I have a bad knee, it's always inflamed.
Yeah.
He said don't do anything high impact.
Right, on that knee. Yes, right. Yeah, I mean, I wouldn't, if your knee is hurt, I wouldn't necessarily walk on it or, but there's other things that you can do. You can use a resistance band, just to keep your upper body strong. You can do core exercises. So there's different things you can do even without putting stress on that knee. Yeah. Yes. Yeah. And the other thing is get your blood levels of iron, vitamin B12, and vitamin D checked because low levels of these could possibly cause anemia, which then can cause fatigue. If you suffer from abdominal pain or bloating, some of these gassy foods should be avoided. Broccoli, cauliflower, cabbage, peppers, starchy beans, and carbonated beverages. And again, this is going to be totally individual. These foods may not bother everybody, and not all the foods on the list may bother you. So it's just going to be trial and error. I think the important thing is to kind of keep in mind what you're eating, and we'll go over that a little bit later too, is keeping a log of what you're eating and symptoms that you may be having. If you suffer from gastroparesis, and gastroparesis is a delayed emptying of your stomach, which could cause nausea, vomiting, abdominal pain. It's common in patients who have diabetes and who have poorly controlled blood sugars. And it's also could be common in people who are on chronic narcotics or pain medicine. Medicine just slows down your whole GI tract. So it could cause gastroparesis, it could cause constipation. So that's something to keep in mind. And what you want to do is avoid foods that are very high in fat. Okay, some of these are listed: hamburgers, ribs, sausage, hot dogs, bologna, pepperoni, bacon, fried foods, and desserts. So because fat empties last from your stomach, okay? It just feels like it sits there for the longest period of time. Protein and your carbohydrates are the first to empty from your stomach. Fat takes the longest to empty and the longest to digest in general. Okay, so if you're already having some delayed stomach emptying, avoiding these foods will help. And again, eating small, frequent meals, keeping active, and taking a probiotic supplement that we mentioned. In addition to eating yogurt for the probiotic supplement, there are also supplements, pills that you can take. Things like Lactinex or Culturel. There's a whole variety of those out there. So if you feel like you could benefit from one, definitely talk to your doctor about it. For gastroparesis, there are also prokinetic drugs that you can take that will help with the motility. So, if you are having problems with this, then that could be something that you can consider. Other foods to keep in mind, some of you may have heard of the nightshade vegetables. These include tomatoes, eggplant, peppers, and potatoes. And these foods are potentially pro-inflammatory, and if you are sensitive, they may cause symptoms such as diarrhea, gas, bloating, nausea, painful joints, headaches, and depression. And I've heard a lot in rheumatoid arthritis or those types where I really feel like there's much more research done in those types of illnesses. One of the things that they normally do is they avoid these nightshade vegetables just to kind of decrease inflammation. Other foods to keep in mind, people who have autoimmune diseases are sometimes more prone to get other autoimmune diseases, so scleroderma patients may be at a higher risk of having celiac disease and not being able to tolerate wheat products, like you mentioned, and gluten intolerance. Gluten is a protein that's found in wheat, and it includes foods that contain wheat, barley, and rye. So if you do feel like you're having a lot of abdominal symptoms, a lot of GI issues, a lot of bloating, then that may be something that you want to bring up and consider. How to tell which foods are problematic. If you are having a lot of GI symptoms, one thing I would recommend doing is keep a food journal for a week. So write down everything that you're eating, when you eat, and the symptoms that you're having, okay? And the symptoms can occur 5 minutes to 24 hours after eating a particular food. So that's why it's important to write it down. Otherwise, you're going to forget what you ate when and what symptoms you were having. And you could potentially try the elimination diet challenge, which is where you pick one food group at a time and completely avoid it for 3 weeks. So say if you thought you were having problems with the nightshade vegetables, you would just pick that one category and just eliminate them completely from your diet for 3 weeks and see if any of the symptoms were alleviated. And then if you want to reintroduce them one at a time so that you can kind of tell, if potentially one of those things was causing a problem. And again, recording your symptoms, just writing everything down and recording what you're eating and what you're feeling and how long after you ate that it was happening. Okay. And that's all I have. So we have a few minutes left for questions, if anyone has any questions.
And the request is if you have a question, you wait for me to bring you the microphone. Otherwise, we won't hear it on the video. So any questions?
I'm trying to cook as many fresh vegetables as possible, and I see broccoli and cauliflower, which is what I make quite often, is causing bloating.
Right. Well, as I said, it's totally individual. So if you don't have problems with abdominal pain or bloating after you eat those vegetables, then by all means, go ahead and eat them. They're very, healthy, rich in antioxidants, fiber, vitamins, minerals, all the good stuff that you need. So if it's not causing you any pain or bloating, any symptoms, then by all means, go ahead and eat them.
Okay, great.
Thank you. You had mentioned turmeric as a really good spice. Is a supplement almost as good? I know it's never as good as the actual product, but can a turmeric supplement, like a pill form, help?
I would definitely consider that. I haven't heard of anyone who has used. I don't have much experience with the turmeric supplements. I know it's available.
The other question is, with multivitamins, someone told me that you have to be really careful in terms of what is a really good high quality. Is there something that we should look for in terms of, FDA approved or how do we know that we're getting the best supplement?
Good question. I would maybe talk to your doctor, but I don't think there's that much of a difference, to be honest with you. Like, if you look at the ingredients in each of them, they're pretty much the same. Whether you buy a generic form or you buy an expensive brand name like Centrum Silver, it's I advocate going for the cheaper generic stuff because I really don't feel like there's much difference.
I have heard in earlier scleroderma talks not to get the vitamins that help your immune system, because our immune systems are already doing pretty well in a way, and then they're giving us drugs to calm them down, and but we don't want to
you don't want to overdo
immune
it.
boost. We
No,
don't want to. We don't ginkgo biloba and all that.
No. Oh, so you're not talking about vitamins. You're talking about all those herbs.
Well, sometimes they stick them in the
ginkgo
vitamins. You know, they have these multivitamins that help your immune system.
Right.
You don't want that, I don't think.
Right, but just a generic daily multivitamin with minerals is definitely beneficial, especially if you're not getting all those things in daily.
On the schedule here, you had Tums to take. Doesn't that cause calcium buildup?
Well, it depends how much you're taking. I mean, you don't want to be eating multiple Tums all day long. If you're taking a couple Tums after a meal, that should be fine. Because, Tums it's calcium carbonate. Mm-hmm.
Hi. I have Raynaud's. Okay, I had scleroderma. Now it's in remission, but I still have the Raynaud's. Now, instead of the Procardia, what I use is a little bit of red wine, and that has worked phenomenal. Just a little bit of red wine.
Yeah.
And everybody's like, oh, why don't you just have it? And it's like, more. And it's like, no. It's half a glass once a day, and it works.
Sure,
I don't know if anybody else have the same experience with red wine for Raynaud's.
And, the Mediterraneans, they drink a lot of red wine. So I guess that's part of the Mediterranean diet as well.
If you're going to use turmeric, how much of it should you be using?
There's no data that specifically that states how much that you should be using. I haven't read anything about how much is beneficial or or anything like that. There's only so much you can use in your cooking because it is strong. Yeah. Okay, and it stains everything around, so be careful. It's coming around. Someone here?
Question?
Yeah, we came because of the Raynaud's, but will you explain what this stuff is? Scleroderma, whatever how you say it. We came for Raynaud's, but what is this? We don't know about this stuff. Yeah.
Okay. So it's basically a systemic hardening of the skin, and a lot of the scleroderma patients have Raynaud's. But it could affect different parts, different organs in the body. So for some patients, it affects their GI tract. In other patients, it affects their lungs. So it's basically a hardening of the skin and calcification of different. Not everybody has it, but from what I've seen, it's a pretty common thing with scleroderma.
The incidence of having Raynaud's when you have scleroderma is pretty high.
It says 95%.
Although you may not have one or the other, you could potentially have both. And Dr. Cronin can certainly speak further towards that.
How long have you had the Raynaud's?
I just have the white fingers I get when it's real cold.
Oh, okay.
But no one of the other symptoms. I don't know. I never realized any other of the symptoms.
Keep warm, so always just wear gloves and keep your hands warm as much as you can, and that should help.
There's a blood test. Isn't there a blood test to diagnose scleroderma?
I'm sure there is.
There is, but it doesn't. There's an SCL70 antibodies, which are predominant in some scleroderma patients, but you could still have scleroderma and not have the SCL70 antibodies.
Right.
So it can determine, but it's not the only determinant. There's,
If you had scleroderma, you'd probably know it.
Yeah.
You don't want it.
Dinaz, can you talk about maybe appetite stimulants like Megas?
Yeah.
Just
yeah.
a little bit.
Yeah. Maybe you can talk about it better. So I know you've tried it and it worked for you, right? So if you have a chronically depressed appetite, in addition to trying all these different things, small frequent meals and nutrition supplements, there is a pill or a liquid that you can take. It's called Megas. And it's used, it's been used and studied more in cancer patients and in AIDS patients, and it does increase your appetite. So if that's something that's, a chronic problem and you're just unable to maintain your weight and underweight, then Megas, talk to your doctor about it. It could potentially be something to try. And I know my sister-in-law tried it and she found that it helped. So. MEGACE is the Megas.
Did you all hear that?
Or megastrol acetate or something is the.
And see near if you need further spelling.
Megas. It's been around forever, but it's mostly been used in cancer patients, AIDS patients, that kind of thing is where it's been used more and studied more. Yeah.
Any further questions? Well,
yeah.
Yeah, how about the
not alcohol related?
Not for alcohol, just for drug. So for medicine, sometimes it's the brand and sometimes it's genetic or the same thing or not.
Same thing.
Same one, genetic and brand.
Mm-hmm.
But
just much cheaper.
Right?
Yeah.
Yeah.
You don't know that. Sorry. I have scleroderma, and I was in pharmaceutical marketing prior to being diagnosed. So unfortunately, I had the knowledge going into it of the difference between a generic and name brand.
Mm-hmm.
It is basically the same, but not 100%. So as in any medication that is given to any individual, it is only works in 66% of the population straight off the bat. So when you start adding in something like scleroderma and all these other autoimmune disorders, that also cuts down on it. So, I mean, I'm on Cellcept, and I had to fight tooth and nail to stay on Cellcept because it was helping me. And moving to a generic, the properties are similar but not the same. So I always say, it's kind of like when you're driving a car. Yeah, a car all does the same thing, it gets you to the same place. But a BMW and a Hyundai are totally different vehicles. So it depends on you.
It depends on you. I mean,
it depends on you. And
will
some generics, like
affect
generic
people differently.
ibuprofen, works fine for me.
Yeah.
And I don't have an issue.
Right.
But
chemically, it's the same.
Chemically, it's the same, but some are, and the reason why some drugs don't have generics is because their medical compounds haven't been let out through their expiration time.
Exactly.
So, there's a reasoning, and then they can't make it the same exact. A generic is not made the same exact way. So it is something, I do understand what you're saying, the same general effect, but when you're dealing with an illness like this, it can have a huge effect one way or the other because it's such a varied illness.
Right, and usually really once the drugs, the patent or whatever is ended, and the secret's let out, then, it gets much cheaper when it
does, but it's, it is. I understand what you're saying. It is basically the same, but that's the whole point. It's not exactly the same.
Right.
So,
but what did you find a difference?
Oh yeah.
And what did you find was different?
I saw onset of. I was on a different drug down through Johns Hopkins that saved my life because I have lung involvement, and I just hit 11 years with it, when I was given 5 years. So for me, I was on Alificept, which was for chronic plaque psoriasis. That was through a clinical trial. I was the only one who had lung involvement in the clinical trial, and I went from 65% lung volume. Now I'm back up to 92% lung volume. So they told me that it would never increase, and it did. So I've experienced a change now. They've changed some of my drugs to generics. Sometimes I feel a difference and sometimes I don't. When they wanted to change my Cellcept to a generic, which is what they put me on for maintenance to kind of keep me the same, I wouldn't let them because once you start to feel a shift in your body, the change can come on much quicker and the recovery is much longer. Right. I could feel a change in a month and it might take me another year to get back to where I was in that loss in a month. So, and I was told to go off my multivitamin by several doctors. So that's also a specific.
Are you eating well? Are you eating well in general? Like
as well as I can. I don't have as much GI involvement as I did lung.
I mean, if you're getting everything that you need, through your diet, then there's no need. But just for the people who chronically,
the B12 was a big issue, and iron. It was a big issue with me. So, but I have a problem with iron where I taste metals, so that's, that became another issue because then that was making me ill, but it's all fun.
Yeah.
Right.